Hello guys, uh, we um, tell talk with you about surgical instruments, and it is second lecture about them. And today we will talk just about scalpel. Scalpel is a tool uh, what we use for separation of tissue in surgery, but I think you know it. A scalpel is a surgical knife used to dissect soft tissues. It is distinguished by the presence of a narrow, sharp, short blade, the length of which can vary from a few millimeters to 10 or more centimeters. Purpose of the scalpel: dissection of any soft tissues, for example skin, subcutaneous fat, fascia, aponeurosis, intestinal wall. In the classic version, the scalpel in one piece uh, is in one piece, yes, and um, that is made from a single piece of tool steel. The main components of the scalpel are the blade and handle and a blade. The transition of the instrument between them is called the neck. This one, neck. Scalpel device include handle, neck, blade, and butt. Butt, it is this part, and um, cutting edge, it is this part. On the scalpel blade, you can distinguish three main components: the cutting edge, um, the tip, uh, the butt. The cutting edge is the sharpened part of the blade that is used for direct cutting. In most cases, it is located only on one side of the instrument. There is also a knife with a double-edged blade. The tip of the scalpel is also partially sharpened. This part of the blade is used for piercing. It is most easily immersed in soft tissues. When using a scalpel for non-surgical purpose, the tip most often falls on a large proportion of the load, so it wears out the fastest. The opposite part of the blade from the cutting edge is called the rim. In double-edged scalpels, it's absent. The pad can be used as a finger rest if a controlled strong pressure on the tool is required during the cutting process. Uh, and removable blade for single use. Of course, we can use it, and now in our future we use just with these types of scalpels. Scalpel designs with interchangeable blades are becoming increasingly popular. There are a separate handle into which preparate blades are inserted. In medicine and veterinary medicine, such tools are disposable. The blades are in a sterile package. They are printed out immediately before use and installed on the handle. In other directions, they change as the cutting edge becomes blunted. Solid metal scalpels, as well as blades, are made of high-quality tool steel. Its properties and characteristics differ depending on the purpose of the tool. For medical scalpels, surgical steel is used. It does not rust and does not give oxides in contact with various liquids. In scalpels of technical use, ordinary tool steel can be used in contact with water. It will rust. This is more true for budget replacement blades. And classification of scalpels, they delayed for uh, shape and size specific narrow tasks. In general, medical knives can be divided into the following types: abdominal cavities, amputations, and microsurgical. Um, First type of all scalpels is pointed. Pointed ones are distinguished by a thin pointed nose. This shape allows you to use the tools to make narrow, deep incision in soft tissue. The tip can be centered or offset towards the cutting edge. The pointed scalpel is also often used for fine carving, working with selected skin. Abdominal. The ventral ones are distinguished by the presence of a rounded nose. Due to this, when making an incision, they do not deepen, but go along the surface. Such a tool cuts more than deepens, it leaves a long, shallow cut. Abdominal scalpels are most often used when performing operations on the abdominal cavity for which they received the name. Cavities. Cavities are distinguished by the presence of a long handle. The blade itself has an oval shape. The point as such is not present in it. Due to this, it is difficult to make an incision for dipping with such a tool. It is used to perform cuts in cavities, for example when removing pathologies. Due to the absence of a protruding, sharp nose, they can not accidentally catch the surrounding tissues and leave deep cuts on them. Amputation knives is most often called a knife. Yeah? It rarely looks more like it, as it has a large blade that exceeds the size of the handle itself. It is a powerful tool designed to perform amputations. They cut off limbs, body parts, organs, and it also used in autopsies. The instrument is represented by a wide variety of sites that are convenient for performing a particular amputation. The length of the blade of such a scalpel can reach up to 150 millimeters. The tool has a massive handle, usually flat. Despite its great length, the width of the blade is made narrow. And the last one is a microsurgical scalpel. It's characterized by the miniaturization of the blade. It can have a different shape and angle of the tip. Such tools are designed to perform the miniature dissections, for example by ophthalmologists, dentists. They are also used to perform operations to connect tendons and blood vessels. These types of scalpels can be equipped with various variations in the shape and size of the blades for specific tasks. They can be rounded, concave, curved. They are separate types of scalpels designed and used specifically only for dissection only one particular pathology muscle or vessel in hard to reach places. Each scalpel size and shape has its own number. This allows you to distinguish them. The numbering of the blades goes from smaller to larger. So, for example, numbers 10, fifths, 20, 21, 22 are used for abdominal surgery. Instruments 11, 23, 24 have a sharp edge. The difference in numbers allows you to select a holder of the blades so far the range of blades 10/5 persons, the handle number 3 is used and from 16 number 4. And there we delayed scalpels for the classification. Pointed scalpels with the help of which deep but not wide incisions are made. Number 11, 12, 13, 14, 15, 16, 18, 23, 25, 26. Scalpel with blade 12 used for removing stitches. Abdominal. Abdominal scalps make long and wide incisions, but not deep ones. It's number 10, 5, 18, 80, 18, 19, 20, 21, 22, 24. And cavity. Cavity or radius scalpels have a long handle and an oval sharp semicircle blade. Used to work in the depths of the wound, scalpel with blade sides often used as a scalpel for removing postoperative stitches. And the last one, disposable scalpels. On sale there are disposable scalpels with a plastic handle. They do not provide for the possibility of replacing the blade. This is an expensive tool that must be replaced after the loss of cutting qualities. It has the same design as a medical disposable scalpel, only it is not sterile. And that's all. Thank you very much for your attention, and in next topic you will see something about scissors. Bye bye, see you in next lecture.